Resveratrol and fibrotic scarring after glaucoma surgery. Glaucoma filtering surgery, trabeculectomy, lowers eye pressure by draining fluid through a small fistula under the conjunctiva. However, normal wound healing can overdo it. Fibroblasts invade and transform into myofibroblasts, producing excess collagen in scar tissue. This scarring can plug the new drainage, filtering bleb, causing surgical failure. Surgeons often use anti-scarring drugs like mitomycin C, but these can have serious side effects. Resveratrol, a natural compound in grapes and berries, is known for antioxidant and anti-inflammatory effects. Emerging evidence suggests resveratrol may also dampen fibrotic signals in tissues. This article reviews how resveratrol might modify pathways, like SIRT1 and TGF-β, that drive fibrosis in ocular tissues, evaluates its human safety and dosing, and considers how to test it after trabeculectomy. We summarize what is known about resveratrol's effects on key scarring processes and how it might be used to help preserve the filtering bleb. Fibrosis pathways and resveratrol's actions. After trabeculectomy, injury to the conjunctiva triggers a cascade of healing steps: inflammation, tissue proliferation, and remodeling. Very early on, inflammatory cells release TGF-β, transforming growth factor beta, a potent growth factor that drives fibroblasts to proliferate and become myofibroblasts. These myofibroblasts produce a dense extracellular matrix, collagen, fibronectin, etc., and express contractile proteins. In the eye, this scar plugs the bleb so that fluid no longer drains properly. In essence, a tightly balanced scarring response is needed for a safe bleb. Too much scar widens bleb wall closure and bleb failure, while too little scar can cause leaks or hypotony. Thus, controlling but not completely blocking these pathways is the goal. Resveratrol can influence several molecular targets involved in fibrosis. SIRT1 activation. Resveratrol is known to activate sirtuin-1, SIRT1, an enzyme that regulates gene expression. SIRT1 acts like a brake on fibrosis. In skin and organ fibrosis models, boosting SIRT1 sharply reduced collagen production and myofibroblast markers. One study of human skin cells showed that activating SIRT1, similar to resveratrol's effect, almost completely blocked TGF-β-driven collagen synthesis and myofibroblast formation. In mice with induced skin fibrosis, a SIRT1 activator halted and even reversed scarring. In short, SIRT1 naturally restrains the TGF-β SMAD fibrotic program, and resveratrol's SIRT1 activation may impart these antifibrotic benefits. Inhibition of TGF-β SMAD signaling, transforming growth factor B, is a key switch for fibrosis. When TGF-β binds receptors on fibroblasts, it activates SMAD2/3 and SMAP4 proteins that move to the nucleus and turn on scar-making genes, collagen, fibronectin, alpha-smooth muscle actin. Resveratrol interferes with this cascade. In cultured trabecular meshwork cells, resveratrol reduced TGF-β1 levels and the activity of downstream SMAD proteins. It downregulated TGF-β1 and SMAP4 gene expression while upregulating the inhibitory SMAT7. Computer simulations suggest resveratrol binds with SMAP4's MH2 domain, hindering the SMAD complex from turning on fibrosis genes. The result was dramatically lower production of collagens, type 1 through 4, fibronectin, and ISMA by those cells. Other studies confirm this anti-TGF-β effect. In human ocular fibroblasts from pterygium tissue, resveratrol blocked TGF-β1-induced fibrosis. It dose-dependently suppressed TGF-β1-induced collagen 1, fibronectin, and ISMA expression, and weakened SMAD3 and other signaling, MAPK, PI3KKT activation. In summary, resveratrol disrupts the canonical TGF-β SMAD fibrotic signals, tipping the balance away from excessive matrix production. Suppression of myofibroblast differentiation. Myofibroblasts are the main scar-making cells. They generate contractile fibers and collagen. TGF-β drives fibroblasts to become myofibroblasts marked by ISMA. By blocking TGF-β signaling, resveratrol reduces this transformation. In pterygium fibroblasts, resveratrol not only cut ISMA and collagen expression, but also inhibited fibroblast proliferation, migration, and the contractile wound closing, behavior induced by TGF-β. In skin wound studies, topical or injected resveratrol improved healing with thinner scars. A review of skin wound models found resveratrol counteracted excessive scarring. In animal models of hypertrophic scars, resveratrol treatment reduced collagen levels and FASMA in scar fibroblasts. Together, these data suggest resveratrol keeps fibroblasts from fully becoming stubborn myofibroblasts. In sum, resveratrol acts on multiple levels of the fibrotic wound healing cascade. It activates SIRT1, which inherently suppresses fibrotic gene programs and directly interferes with TGF-based SMAD signaling and related pathways. This dual action both slows new scar synthesis, lowering collagen and SMA expression, and enhances matrix breakdown by boosting enzymes like TPA, shifting toward tissue remodeling. The net effect in cell studies is less collagenous matrix made and more degraded, which could keep a filtering bleb more open. The challenge is ensuring enough healing for bleb stability, but avoiding oversuppression that leads to bleb leaks. Resveratrol effects in ocular cells and tissues. Although much of the research on resveratrol's antifibrotic action comes from general wound healing models, several studies have directly tested resveratrol in eye-related cells. Trabecular meshwork cells, human trabecular meshwork (TM) cells, are responsible for draining fluid from the eye. In glaucoma, steroid exposure or other factors increase collagen in the TM, blocking outflow. Abu Bakr et al. Treated cultured human TM cells with dexamethasone to mimic glaucoma distress and resveratrol. Resveratrol, 12.5 monomember, significantly reversed the steroid-induced rise in collagen 1, 3, 4, fibronectin, and alpha-SMA at both gene and protein levels. It achieved this by lowering TGF-β1 and SMAT4 expression and raising SMAT7, an inhibitor, as noted above. These changes were accompanied by increased levels of tissue plasminogen activator, TPA, and reduced plasminogen activator inhibitor 1, markers of a shift toward matrix degradation. In functional terms, this was linked to improved outflow in animal studies. The TM cells showed no toxicity at these doses, supporting feasibility of targeting TM fibrosis with resveratrol. Conjunctival fibroblasts. After trabeculectomy, the conjunctiva and Tennant's capsule under the bleb are the main sites of scarring. Human Tennant's fibroblasts have not been studied with resveratrol specifically, but similar cells have. In human pterygium fibroblasts, surplus conjunctival tissue often removed during eye surgery, Jiang and colleagues found resveratrol dose-dependently suppressed TGF-β1-induced fibrotic activation. This included lower expression of type 1 collagen, fibronectin, and alpha-SMA, and blocked fibroblast proliferation and migration. These ocular fibroblasts came from patients' eyes, so they behave like conjunctival fibroblasts in surgery. Notably, resveratrol here also encouraged some fibroblast apoptosis when challenged with TGF-β1, suggesting it helps remove overactive cells. Animal wound models. In mice with skin wounds or scar models, resveratrol applied topically or intradermally improved healing with less scarring. While skin differs from the eye surface, the cell biology is analogous. Reduced fibrosis in skin means resveratrol is modulating the same basic pathways, e.g. SIRT1, that likely apply to conjunctival wound healing too. In one mouse burn wound model, intradermal resveratrol suppressed markers of scarring, reduced collagen and SMA, and activated SIRT1 in the wound site. These findings bolster the idea that resveratrol can counteract excessive scarring in injured tissues. Taken together, these data in ocular and analogous cells support the notion that resveratrol could mitigate bleb fibrosis by dampening the cellular processes that make scar tissue. The remaining question is whether systemic or local treatment in patients could achieve these beneficial molecular effects safely and at the right time in healing. Safety, dosing, and drug interactions. Resveratrol supplements are widely available over the counter, often 100 to 500 milligrams per capsule, typically from grape extract or Japanese knotweed. Human trials have tested much larger doses. In a landmark study of 40 healthy adults, volunteers took 0.5, 1.0, 2.5, or 5.0 grams of resveratrol per day for 29 days. All doses up to 5 grams were generally well tolerated. Mild to moderate gastrointestinal symptoms, nausea, gas, cramping, diarrhea, were the only common side effects at 2.5 to 5.0 grams. No serious adverse events were observed and no abnormalities on blood tests were found. Notably, the higher doses, 2.5 grams per d, often caused GI upset in nearly all volunteers, though symptoms resolved after stopping. Based on this and other reviews, an upper daily limit of about 1 gram for most people is generally recommended. Doses below 500 milligrams are very safe, while doses above 1 gram may yield more side effects. Typical resveratrol capsules sold for wellness purposes supply 100 to 250 milligrams. Clinical trials looking at metabolic or eye diseases have used anywhere from 5 milligrams to 2 grams daily, depending on the goal. Lower doses, 50 to 250 milligrams, have been seen to improve blood sugar and vessel function in some studies, but effects often plateau or reverse at higher doses. For a glaucoma patient, a safe starting dose might be a few hundred milligrams per day, potentially increasing cautiously if needed, while watching for tolerance. The form, capsule, powder, or possibly eye drop would need to be standardized in trials. Drug interactions. A major consideration is that resveratrol affects liver enzymes called cytochrome P450, CYP. It can inhibit several CYP isoforms and drug transporters, altering metabolism of many medications. For example, resveratrol is a potent inhibitor of CYP3A4, a key enzyme for many drugs. In the clinic, 1 gram per day resveratrol significantly raised blood levels of CYP3A4 substrates. Buspirone AUC increased 1.5-fold. Similarly, a human trial found 1 gram per day resveratrol for 4 weeks inhibited CYP2C9 by 2.7-fold, measured using losartan, consistent with rodent data showing resveratrol boosts warfarin's blood thinning effect. Another study showed resveratrol reduced CYP2D6 activity 1.7-fold, meaning it could slow activation of drugs like tamoxifen. In essence, resveratrol could cause higher levels of drugs normally cleared by these enzymes, especially concerning for drugs with narrow safety margins, e.g. warfarin, digoxin, certain glaucoma eye drops, some cancer drugs. Resveratrol also inhibits drug transporters such as P-glycoprotein, which can raise levels of many drugs. One trial found 500 milligrams resveratrol blocked PGP in humans. In summary, short-term resveratrol supplementation up to 1 gram per day appears safe in healthy adults. Common tolerable doses, 100 to 500 milligrams daily, are achieved by diet or supplements. Very high doses, above a few grams, mainly cause GI discomfort. However, because resveratrol can alter CYP enzymes, especially CYP3A4, CYP2C9, CYP2D6, and drug transporters, patients on other medications like blood thinners, seizure or heart medications, etc., must use caution. In designing studies or therapies, any drug interactions should be carefully screened. Dose adjustments of co-medications might be needed if resveratrol supplementation is started simultaneously. Timing of therapy, balancing healing and scarring. The question of when to start resveratrol after trabeculectomy is crucial. Wound healing progresses through phases: immediate clotting and inflammation, days 0 to 3, fibroblast proliferation, days 3 to 14, and remodeling thereafter. TGF-β and myofibroblast activation ramp up early in the proliferative phase. If resveratrol, or any antifibrotic, is given too early, it could impair necessary tissue sealing. If given too late, the fibrotic scar may already be well on its way. A moderate strategy might be to initiate treatment a few days after surgery, for example, starting around post-op day 3 to 7, when the conjunctival bleb has closed, but before the full fibrotic response peaks. This timing could still catch TGF-β-driven myofibroblast differentiation while allowing the eye surface to heal initially. Care must be taken not to oversuppress scar formation. Some degree of healing is needed to form a stable bleb wall. Experience with mitomycin C shows that excessive suppression can lead to flat, thin, leaking blebs with low pressure, hypotony, or leaks. The goal with resveratrol would be controlled scarring. Enough fibrous matrix to support the bleb, but not so much that the filtering passage is blocked. Because resveratrol's effects appear dose-dependent, low to moderate dosing might gently back down fibrosis, whereas very high doses could risk underhealing. Close monitoring in any trial would be essential to detect if blebs are too thin or wide open. Early clinical trial considerations. If resveratrol shows promise preclinically, initial human studies would need careful design. Early phase, phase 2, trial priorities might include dose escalation and form. Start with a low oral dose, e.g. 100-250 milligrams daily, and escalate to a predefined maximum up to 1 G in small cohorts, observing tolerance. Alternatively, or additionally, topical ocular formulations, drops or slow-release gels, could be tested to localize effect, pending formulation development. Safety monitoring. Carefully watch for the known side effects, GI upset, and for eye-related issues, excessive bleb flattening, hypotony, infection. Record any systemic labs if high doses are used, e.g., liver enzymes. Screen out patients on critical CP450 substrates like warfarin or tamoxifen, or adjust those medications in consultation with their doctors. Timing groups. Possibly compare starting resveratrol immediately post-op versus after 1 week to see which timing better balances healing. A crossover could be complex here, so parallel groups might be used. Objective endpoints. Track intraocular pressure, IOP reduction over time, and bleb health. Bleb morphology, height, vascularity, leakage would be graded by slit lamp exam or anterior segment imaging. Use standardized scales, e.g. Moorfield's bleb grading, as outcomes. Document any need for additional interventions, 5FU injections, bleb needling, repeat surgery, as a sign of failure. Biomarkers of fibrosis, if feasible, measure markers in tear fluid or aqueous humor. For example, TGF-β levels in tears or matrix metalloproteinase activity could indicate biological effect. Conjunctival biopsy scars are unlikely in a trial, but non-invasive scans, optical coherence tomography of bleb, could show subclinical fibrosis. Control group. To assess efficacy, an initial trial might compare resveratrol versus placebo, with both groups receiving standard care. Alternatively, because antifibrotic injections 5FU MMC are often used, one could test resveratrol on top of standard prophylaxis or in place of it, depending on risk. Patient population. Young patients tend to scar more, so initial studies might focus on higher-risk individuals, e.g. younger age, African heritage, secondary glaucomas, where an effect is easier to see. Include enough follow-up, months to a year, to judge bleb survival. Outcome measures. Primary outcomes could be success rate, adequate IOP control without additional surgery at 6 to 12 months. Secondary outcomes, bleb survival time, change in bleb appearance scores, IOP reduction magnitude. In essence, a pilot trial would primarily establish what dose is tolerated and whether any signal of bleb protection appears. Correlating resveratrol blood levels, pharmacokinetics, with effects on ocular tissues would also be valuable. Such studies should be randomized and masked if possible to account for placebo effects. Conclusion: resveratrol's known biology, activating SIRT1, blunting TGF-base signals, and lowering myofibroblast activity, offers a promising antifibrotic strategy for filtering blebs. Lab studies support resveratrol reducing collagen and ISMA in eye cell models, and animal wound studies show healthier healing with less scarring. In humans, resveratrol up to 1 g per day is generally safe, but doses must be chosen carefully to avoid oversuppressing repair or causing drug interactions. It inhibits key P450 enzymes. Key clinical questions remain. Exactly when after surgery to begin therapy, what dose or route best targets the conjunctival fibroblasts without harming the patient, and whether partial scarring, enough to hold the bleb shape, can be achieved. An early phase trial should focus first on safety and biological activity, for example, bleb clarity and IOP control compared to standard care. If resveratrol can nudge healing toward a just right scar level, it could become a useful adjunct in glaucoma surgery. Until then, these theoretical benefits must be tested in carefully designed studies in patients. Wound healing. All links to sources are available in the text version of this article. You can find the full article at visualfieldtest.com. Thanks for listening. To check your visual field, click the link at the bottom of this article or visit visualfieldtest.com.